So much. Well, some U.S. pediatric hospitals are near capacity as RSV cases spike across the country. The U.S. Department of Health and Human Services says pediatric hospital beds are more full now than in the past 2 years. Here to talk more about RSV and how to spot it in your child is Dr. Nicole Macram. She is a Kaiser Permanente pediatrician. Dr. Macram, thanks so much for being with us this morning.
For having me.
So first of all, we just talked about this concern about hospital beds and just the number of cases. What are we seeing here in this area?
We are seeing some early RSV,
Okay.
and we're seeing a lot of viruses, but we have capacity, and our
Okay.
pediatricians are here to take care of our patients.
You know, one of the things we also reported this morning, you and I were talking a little bit about this, is this perceived triple threat where you have RSV, you have flu, and you have COVID. Is that a concern? Is that something parents should be worried about right now?
I think this winter we are going to see a lot of different viruses, and in fact right now we're seeing all three of those.
Okay.
We're already starting to see some flu, and we're seeing a whole slew of other viruses. It's a virus party.
You call it a virus party.
Yes.
Why is that now? Why do you think we're starting to see it now? And did we also see it last year?
Not as much last year and none the year before, and that's
Yeah.
probably why we're seeing quite a bit of it now. So the pandemic's year of shutdown, kids had almost no colds, so also their immune systems did not develop immunity to the things
Yeah.
they would have normally had.
What are some of the things that parents should be looking out for, though? Now, you talk about this virus party. Are there different symptoms, different things that they should be looking out for the different viruses?
That's an excellent question. So I think the most important thing is not worrying about what virus your child has, because it can be difficult to distinguish them.
Yeah.
The great news is with RSV, the majority of kids don't need to come to the hospital and don't even need to come to see their pediatrician. The most important thing is watching how your child's doing. So babies are at highest risk from RSV, and the things that you'd look out for are trouble breathing.
Okay.
So they're breathing really fast, their tummy, their chest is moving a lot, their nose is flaring, and then the big warning sign for parents is if the baby can't eat.
Sure. Okay. And that's for babies. What about like older kids? As I mentioned, I have toddlers. I have a 3 and a
Yes,
2-year-old, so
I'm
I'm
sure
always
you're concerned.
keen to those,
Yes.
that age specifically. So what about toddlers and even maybe older kids?
Yeah, toddlers generally handle RSV much better.
Okay.
They still can get one of the complications called bronchiolitis, but they tend to do much better. But they will have tons of nasal congestion, and the cough lasts 2 to 3 weeks.
Gotcha.
And there isn't a lot of things to do. The most important things for caring for babies and toddlers are a cool mist humidifier, saline nose drops, and a bulb suction to help them breathe.
And what about for older kids? Are the symptoms different?
Yes, they generally are more mild.
Okay.
But we've had this group of kids that haven't had RSV because of the lockdown, and so they may have a little bit more of the symptoms, but they tend to handle it better because their airways are bigger and they can clear the mucus better.
Yeah. What should parents and families be doing to prevent? Is there a way to prevent these viruses, right? Because our pediatrician always says you want your kids to have these viruses when they're smaller, so when they get a little older, they've kind of built up this immunity. Would you say the same thing?
I would say that there's no way to avoid them completely.
Okay.
We know from our 2 years of sort of shutdown and lockdown that our kids really suffered because of that social
Sure.
distancing. So
Yeah.
it's really important for them to be back in school.
Yeah.
But probably the biggest things to help prevent this virus party, one is for sure to get your flu vaccine. The flu vaccine seems like it's going to be a good match this
Okay.
year. It's going to help protect the spread, and then it also helps protect from the severity. Of course, good hand washing.
Sure.
And those sorts of things. And then if your kids are sick, it's best for them to stay home till they feel better
Yeah.
so they don't spread as much.
And what about masking? Would you suggest that as well?
I think that's more of a personal choice.
Okay.
For people, there's definitely proof that the masks helped prevent spread. And we saw that last year. We didn't have as many viruses because kids were still required to mask at schools. So if in the family you have high-risk members, and that's an important thing, I would have your child mask.
Yeah.
But it's a little bit of a personal family decision.
And just for people who may not know, there's no like vaccine for RSV,
That's
right?
a great question. No,
Okay.
but our very highest risk babies, these are babies who are extremely premature or have significant congenital heart disease, they get all winter long an injection called Synagis,
Okay.
which is a monoclonal antibody to help prevent it. But that's only for the highest risk babies.
Gotcha. Is there anything else that families should be doing now as we're kind of heading into this winter season?
Again, I'm going to push for flu vaccines.
Okay.
I think they're going to be extra important because
Sure.
of that. We haven't seen that much flu, and we are already seeing flu.
Yeah.
And then just thinking about who you're going to be around during
Sure.
the holidays and how to best protect them. Maybe not go around grandparents if the kids are sick, or at least do your COVID test to make sure it's not that.
Gotcha. Thank you so much for being with us this morning. A lot of
My
great
pleasure.
information for families.